Welcome back to The Blend. It's Men's Health Week, and with Father's Day just around the corner, we're helping out all the men and dads out there get healthy.
Here to tell us about some common conditions men face and give some heart-friendly tips, Dr. Jud Fisher with some healthcare partners.
Thank you. It's great having you.
Thank you very much. Good morning.
So, a lot of times men are scared to go to the doctor. But what are some of the common factors that you would find that men are facing right now?
Well, based on age group, certainly there's different issues, but the common medical issues for any man over the age of 40, the most common being heart disease. Cardiovascular disease represents one of the most prevalent and difficult, not difficult, but necessary treatment for men and women. As we come up to Father's Day, obviously we're trying to make a big push for health for men, and certainly cardiovascular disease is something we are very, very interested in prevention. We can start early and help prevent bad outcomes later on in life for men, so that when they're in their 70s, 80s, they're not having a sudden surprise. We've done things from 40s, 50s, 60s, and 70s to help prevent atherosclerosis and help prevent type 2 diabetes, etc.
You mentioned that Father's Day is coming up this Sunday, and I know how my father reacts about going to the doctor. He's like, you know, healthcare partners, I'm sure you've seen quite a little bit of being scared about going to the doctor as well. What are some of the things you've seen, especially with senior men coming in?
Well, still, the most common thing, and oftentimes, thankfully, with a lot of the senior men, we have their wives, and in general, women tend to be a little bit better about routine maintenance, and they say, you know, honey, I still love you. I'd like to see you around. So they get their husbands to come in, and we actually are dealing with some of the same problems.
Yeah.
Hypertension, type 2 diabetes, trying to prevent heart disease, high cholesterol, all of these are tied together in reducing their risk and helping to prolong and improve their quality of life.
And it's Men's Health Week right now.
Yes.
So what better time to start and possibly get a prostate exam? Is it ever too early to get a prostate exam?
Well, it's not necessarily too early, but screening recommendations are based on the patient and family history and symptoms. So when a male goes to see the doctor, they can talk to them about any symptoms they may be having, such as difficulties urinating, having to get up at night frequently to urinate, etc. And family history. If there's a family history of prostate cancer, a man's risk for prostate cancer goes up substantially. Lifetime risk is roughly 1 in 9, 1 in 8 for men for prostate cancer. If there's a direct family history, it's roughly 1 in 3. It's very comparable to the increased risk when there's direct family history of breast cancer in females.
Of course, no guy looks forward to necessarily having the prostate exam, but it's a lot better than the alternative.
Yes, prostate cancer is a disease that when found early is highly treatable and or curable. And so that's a wonderful thing for us to be able to tell patients that we can do for them.
What's the average age, do you say, that people start having a prostate exam?
Well, the recommendations for those not at high risk is age 50 for most men. If there's family history, we start earlier. African American males, we typically recommend age 45 because there is a higher incidence of prostate cancer in Black American males. So it's a digital rectal exam combined with blood tests, the prostatic specific antigen that you hear talked about, the PSA, and that's part of the beginning of the exam to screen for prostate cancer.
Gotcha.
And you're talking about cardiovascular heart disease. It's a big problem for men and women. It comes up. What advice would you give for men that are facing that?
The first bit of advice for heart disease, and it sounds like a broken record, but please, everyone, do what you can to stop smoking.
Yeah.
There's nothing worse you can do for your blood vessels than smoke. So stopping smoking, get to your doctor, form a relationship with a physician that you are comfortable with and you can trust and you feel like they're interested in your well-being. Control your blood pressure, control your glucose levels if you have type 2 diabetes, control your cholesterol, understand what your goals are. Talk to your physician and say, what is my goal for my low-density lipoprotein, my bad cholesterol? What is my blood pressure goal, and how do we get there working together? And then talking about things that the patient can do aside from medication, lifestyle modification, exercise, and it doesn't need to be a marathon. Get out and walk for 30 to 40 minutes, 5 to 6 days a week, and then you can talk with your physician about foods that are excellent to help maintain heart health. And we could go through some of those at some time if you'd like to.
Now, healthcare partners, the patient's pretty much the sun. If it was the solar system, it is a patient-centered healthcare approach to wellness and to healthcare. Explain how that works and what you're doing at a healthcare partner.
Well, you're exactly right. It's a patient-focused strategy. I mean, it should be. They are the most important thing to us.
Although commonly it's not.
Patients and our employees for healthcare partners are the most important thing to us. And we focus on what is right for that individual patient. It's so important for us to really have a good rapport with patients and to understand their family history, understand what type of job do they do. Are they at risk for other disease states that we can help prevent now so that we're preventing problems down the road? We want people to live a good life, a happy life, a healthy life, and we want to be a partner with them to ensure they're getting there.
And the greatest part is making sure that every doctor along the way is playing on the same playbook.
Exactly.
And that's one thing you can
We
offer.
really try to encourage excellent communication between primary care physicians like myself, I'm a family practitioner, and our specialists. So when I send a patient to a cardiologist, to a neurologist, to a pulmonologist, to a etc., make sure that we all understand where we're going and what we're trying to accomplish for this patient with good communication.
We know you guys are using Facebook and Twitter, and we actually have a question from one of our viewers. And they said, my dad is over 70 and rarely sees a doctor. What kinds of yearly screenings should he be having at his age? I know Sean kind of touched on that.
Excellent question. Age 70, many different things. I've already talked about the cardiovascular disease, checking blood pressure, looking at cholesterol, looking for risk for type 2 diabetes. Those are crucial. Next things, annual eye screen. Make sure that you're at least seeing an optometrist or an ophthalmologist to have tonometry done to check for glaucoma. We want to make sure they're having annual digital rectal exams and PSA. We want to make sure that they're having appropriate intervals of colonoscopy, colonoscopy being a screening tool for colon cancer, recommended at age 50, and then depending on the patient type and individual occurrences, perhaps every 5 to 10 years thereafter or sooner. We want to make sure that the patients age 70 or older are aware of safety issues. We want to make sure that they understand that when they have questions and they have issues, they see something in the media they're concerned about, come talk to us. That's why we're there. And if there's things we don't necessarily know the answer, guess what? We will get it. If you find a doctor that knows everything, run.
Because they usually, no one knows everything.
Exactly.
But it's a collective group
Exactly.
of
We can work together with my friends and colleagues, and we can find out what the answer is.
All right, we have another question. I'm going to add a little bit to this too. Women are encouraged to take calcium to reduce the risk of osteoporosis. What types of supplements should men take? And my addition to that is there a difference between the hard supplements and the liquid supplements, the liquid capsule supplements?
Well, there's some people in the vitamin industry that push for, as opposed to the compressed vitamin capsules, looking at the actual gel forms. My issue is that dietary supplements are important, and there are some key things that I recommend for virtually everyone. But the focus should be food first. If we can get patients to consume a good diet and exercise, as I spoke about, there's going to be diminishment of a whole lot of these risks that we have. So food first, but I'm a realist enough to understand that food is, no patient's going to eat perfectly. Even if they have a nutritionist following, there's going to be some individual likes and dislikes. They may not want to consume blueberries, cherries, almonds, walnuts, salmon with omega-3 fatty acids in it. So we supplement. I typically recommend for men a good quality multivitamin that typically does not have iron. Most men get enough iron and don't need to supplement that. If, based on their history, I will also recommend omega-3 fatty acids, fish oil supplements.
We get one more question really quick. I'm a 40-year-old man and haven't seen a doctor in years. What age do I need to start seeing a doctor regularly? I think every age is probably a good idea, right?
If you start feeling symptoms.
Certainly symptoms. If your body's giving you clues that things are changing, you don't have to be 40 to see a doctor regularly. See a doctor sooner and go through these things your body is telling you. And don't deny them. Be a realist about what your body's telling you. But at age 40 certainly is a time to be seeing a physician regularly. Even for people who don't have high blood pressure, guess what? By the time they're 50, the incidence goes up. By the time they're 70, if we live to be old enough, we will. So age 40, good time to start and talk about risk factors and set up a plan for the next 10 years with your physician of, we need to screen for these things regularly, or we don't need to screen for these, and give the patient guidelines and education on what they can do to further their health.
Doctor, a pleasure having you here.
Excellent information.
Thank you very
very
much.
helpful.
Hey, if you want more information on Healthcare Partners of Nevada, you can ask them a health question. You can tweet to them. You can use the address that's right there on your screen. You can also join them for Men's Health Week through Twitter and Facebook as well. And for more information, log on to keepmydoctornv.com.